To improve health equity and access to care for our patients, the cornerstone is to understand the needs of the patients. Whether it's lack of transportation, access to food, or just basic needs around the house, all these things can factor into the continuum of the care they get. Today, to talk more about that, I have a special guest with me, Tracy, so stay tuned.
You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Welcome to another episode of All the Pieces. I'm your host, Dr. Mohan, your Chief Quality Officer, and today we'll talk about AIM Network as well as the needs of the community and what it means for us as an organization with a special guest, Mosaic's Community Network Program Manager, Tracy Spillman. Welcome, Tracy.
Thanks for having me.
So before we get started, tell us a little bit about yourself.
Well, I have been with Mosaic for about 13 years. I started in 2011. I am a master's prepared social worker. Spent 18 years in child welfare in the Kansas City area. And I started with care management as a social worker in the pediatric clinic, and I've been in this role for about 5 years now.
Excellent. Welcome, and thank you for being with the organization.
Thank you.
So, as I mentioned earlier, the needs of the patient comes in many different ways, not just the medicine we provide, but also the needs in the community. Mm-hmm. What are some examples of how a person's living conditions can impede the care they may get at the medical center or the primary care office?
Well, we understand that most of what impacts a person's ability to manage their health happens outside the walls of the hospital
Right.
and the clinics. So any of those social barriers, such as homelessness or inability to pay for utilities or domestic violence, any of those things impact a person's ability to manage their health. And we know also finding resources is difficult.
Right.
We all have paper lists, but as soon as those are printed, they're out of date. So we utilize the AIM Find Help Network really to search for and connect people to resources.
AIM Network. Mm-hmm. What is that?
So the AIM Network is just really a collaboration of community organizations. Mosaic launched it in 2019, understanding what we were just saying, that we have to address those social barriers in order for someone to manage their health adequately. So community organizations who may provide education or health care or other resources that we can connect people to address those barriers.
So it's highly individualized.
Mm-hmm.
So you've been here for a decent amount of time. What trends have you noticed in our community that is sort of the overarching trends or themes?
The biggest trends that we see in the analytics within our platform, it's interesting because when we launched with this platform, it's been 2 years ago. The first year and a half, those top searches were mental health and housing. Around the first of the year, it switched and it was transportation and housing. So we have the ability to see what are those trends at any given moment by using the platform.
And the platform is AIM Network's platform?
The platform is AIM Network, and we use the Find Help platform. It's a web-based platform that allows us to search for resources and actually make referrals and connect to those resources for someone.
And you mentioned it's a collaboration of agencies. How many agencies participate in this network or platform?
We currently have 24 member organizations in our service area. We're working on a couple in the Maryville area right now of joining the network. But the beauty of the platform is you don't have to be part of the AIM network to utilize the platform.
Okay.
We can search any zip code in the United States for resources.
And usually, if there's a resource identified that the patient might need, what's the normal turnaround time for, say, transportation? I'm sure you can't build houses for them.
No.
Right?
And transportation is that one thing across our entire service area that is a problem, even finding that resource, even being available. Within the AIM network, the expectation of responding to those referrals is within 2 business days.
Okay.
And it just depends on that organization.
So a physician, if they're getting ready to discharge a patient, they can engage with who? The care management team or with you?
Any any Epic user can access. So this is the resource guide within the Epic platform. So there's a Find Help tab. You can click on that. It pulls your login information in. It pulls the patient's information in, like their zip code, and then you can look at resources at that time. You can make direct referrals, but you can also share those. So maybe the patient doesn't want you to make the referral, but they would like the information. You can actually share directly from the platform, either by an email or a text, and you can also change the language.
Interesting.
Yeah.
So you said this platform has been live since 2019?
The network has been live since 2019. We launched with a different platform, and they went a different direction about 3 years ago. So we searched for a new platform that we could access through Epic, because we knew that we were moving to Epic as our medical record.
Right.
So we selected Find Help at that time and then launched with them in June of 22.
Excellent. Do you have any rough idea of how many patients this network or this platform has affected since it started?
Well, we can look at analytics and we can see any given number of referrals or searches. So for our service area, which is our 4-state area, there's over 85,000 searches.
Oh, wow.
Within our network, I think there's something like 150 to 200 referrals just in the last 90 days.
Wow. So it's impacting a lot of lives in a lot of different ways. How does Mosaic promote the AIM network?
So like I said, it is the resource guide within Epic, but we also have the public site printed with a QR code, as well as the website on all of our after visit summaries. I have postcards printed, and I've given probably 10,000 of those out across the community. And it's interesting, I have an example of someone who reached out to me because of that postcard. So I have my name on there as if you want more information. And I had an email from a woman back in November who lived in Kansas City but was in a motorcycle accident here in St. Joe and ended up in the ER. Got one of the postcards, was back in Kansas City and was wanting help finding a therapist. And I worked down there for a lot of years, but I've been up here for a lot of years. So I put her zip code in and created a folder. You can create folders of resources within the platform. So I created a folder of maybe 10 therapists in her area, and then directly in the platform I was able to share that with her via an email. And I kept in touch with her to make sure she was able to get connected. It took us a couple times of me searching, but about a month later, she emailed me and she said, "Thank you so much. I'm starting therapy this Friday."
That is amazing.
Yeah. And so think of patients that we have that maybe aren't from this area, but something happens and they end up in the hospital. We can actually connect them to resources in their home area.
That's amazing. I think a lot of providers and caregivers forget that we are part of a larger ecosystem around us. We can be very myopic in our approach, right? I'm St. Joe, I'm Albany or Maryville, but even though we're a system, but it's also true for Kansas City as well.
Right.
And we are stronger together, not to use the topic of the day kind of thing.
Right.
But that's kind of an interesting part, because healthcare delivery is one thing, but healthcare maintenance is a whole different animal.
Right.
You mentioned earlier that you saw mental health kind of creeping back up. What aspects of mental health are you seeing in terms of referrals being made, or is it need for a therapist, or is it just...
It's need for a therapist, it's substance abuse, it's any of those numerous things.
The things that have always been a part of our dialogue, but a focus is much more enhanced now post-pandemic, I feel like.
Right.
So what is the website if anybody wants to learn more about the AIM network or the platform?
So we have two sites. The site that is accessed via the patient record, which is just for Mosaic caregivers, is aim-findhelp.com. Okay. The public site, which is what our partner organizations and anyone can utilize, I don't think I mentioned that before, but it's not just an organization. anyone can go to the site and search for themselves and connect themselves or their neighbor or whoever. And that's aim.findhelp.com.
That's a very good call out. So my next question was, is this just for patients or is it just for anybody that can? Anyone can go to this website and find information for whatever. And these collaborations or these resources, are they free?
They're free. Well, it depends on the resource. So the site is for free and reduced cost resources.
Okay.
We do have a few resources that I've asked that Find Help add because they're used in the area and they are part of the network. So that requires me making that request because typically they'll only list free and reduced cost.
Excellent. What if I have a patient or a neighbor that I would know that would benefit from something like this, but they are resistant to that? How do you overcome some of those challenges? Or do you just let them make the decision at the end of the day?
Well, I mean, you can talk to them about what's best for them and would they like some help with this? And if you're in the community and you're doing a search for yourself, it's anonymous. So we won't see that they've searched for that. We'll see what they've searched for so that we know that's what those barriers are in the community. We won't know who did it.
Understand.
Each program has their own card within the website. And each program has what we call a share button. So you can click on that and share it either by text or email. And you can change the language on that as well and send it to them. And then it's up to them if they want to follow up.
I understand. And that's good to know that they have an added layer of discretion because there are many folk who are struggling with different issues, whether it's age-related or, access to resources needed, but they don't want that to be publicly known or their neighbor to know. It's that trust in the community and the trust in that process to say, hey, I have resources out there. So it sounds to me that this is almost all a philanthropic sort of effort to make sure community is taken care of outside of the ecosystem of the hospital, the health system. So, we've talked about this, and I know this is sort of a very noble effort. What other things as a community for, our patients, as community at large, and caregivers, what else do we need to know about the AIM network that can help us deliver that care?
We just need to use it. I think that's the struggle. I think there's just resistance on trying something new. And I know if I had had something like this when I was doing frontline social work in Kansas City in the early 90s, I would have loved it. And you can access it on any any device that has internet. So you can access it on your cell phone or your laptop or your iPad or whatever. You can access it.
So technology has shown itself to be useful at least once.
Well, and the beauty is those resource lists that we try to keep, that we talked about before, are out of date as soon as you print them. Find Help does that for us. So they have a complete curation team that all they do is they add programs. And you can make suggestions on these programs too. So if you've made a referral to a program and you find out that they're out of money to help with utilities, but that's not listed, you can click suggest on their program card, send it to Find Help, and they will make sure it gets updated. So we don't have to maintain the list. We don't have to worry if it's accurate or not. We don't have to do a Google search and see who do I send it to. You can also suggest programs. So if there's a program is helpful, but you're not finding it, you can suggest that to Find Help as well.
Oh, that's very interesting. So there's somebody who's actively maintaining a active roster of resources. Sort of like when you're looking for a promo code for a site. You want to make sure it's working, and half the time they don't work. I would say 90% of the time they don't work. But all the programs in the Find Help platform works.
Yes.
And has been validated by a curated team. Excellent.
And they review them twice a year. That's why they have the suggest button, because things change quicker than that. But also programs can claim their cards and then they can update them themselves. So like our community partners in town have all claimed their programs. So they have the ability to go in and say, we're out of money.
Gotcha. So there's a finite number of resources out there too within this program. So if a program runs out of those resources, they're put off pause until they get some more funding or resources.
Right. And they can update that. And that was part of our goals, is really to increase the collaboration across the community, really promote that person-centered care, but also reduce those duplication of efforts.
Right. So you're not running around circles to make sure the resources are there or not.
Right.
You mentioned something about cards. What does that mean?
So within the platform, so you do a zip code search and you go into the food
Sure.
list, and there's different sections there. So I go into food pantry. The food pantries in the area, the AIM network partners will come up first. So we'll see those. But that's their program card. So it gives you their information, what their hours are, what their requirements are, their eligibility. That's their program card. Gotcha. So if CAP has 5 programs, they'll have 5 program cards. So you're not looking at an organization and trying to figure out which program. You're looking at the program.
And looking at the program itself. And it's up to the patient then to follow through with that.
Ultimately it is. You can make a referral for them. It also notifies them of that referral via text or email, whatever they have requested. And it sends them a link, if they have a smartphone, that they can tap and go look at that themselves.
Gotcha.
But it's ultimately up to the patient if they're going to follow through with that.
You can bring the horse to water, but you can't
make them drink.
But information and awareness is, like I said, the cornerstone of change. And if they have true needs,
correct,
any resource will help.
Right.
What is the strangest sort of resource available that you have seen in your experience? I know you mentioned utility bill reduction. That's pretty significant. I mean, that can make a huge impact on a take home for a patient, you know. Any of the weird things that you've seen in your experience?
I don't know about weird, but I was looking at it one day and I actually found a grant program for parents with kids with cancer. So it was a grant, it was a national program, but it was a grant program to help them with like travel expenses.
Right.
If they had to travel to take their child somewhere for cancer treatment.
And this is like not like St. Jude. This is for like
No, it
because
was.
St. Jude is also big, but they can't take
Right.
every patient
Right.
type of thing. This is
Right.
more local.
It was a national
Okay.
program, and this was been a while ago, so I don't remember the specific details.
And that's a true need, you know, considering treatments can take
Yeah,
a long time.
right. And I've kind of played with it and looked at different zip codes across the country just to
Right.
see what's available. And I've been adding a lot of programs through the Suggest feature up in the Maryville and Albany area,
Right.
just to make sure resources are listed. So
Excellent.
I love it. I mean, it's such a great resource.
Absolutely. You know, in my experience, I've been here 9 years now, and I can tell you there was a time, there's a patient, he was a truck driver. He had a cardiac event, but he had his pets with him, you know, and this Find Help platform actually found a free pet boarding service for them, which was, I was like,
Yeah.
who would have thought that that's
Right.
even available? But that was a big concern for the patient
Right.
while he was undergoing, you know,
Right.
essentially cardiac surgery at the
Right.
time. But they got the care that they needed for their
Right.
pets,
Right.
which was a huge stressor for this individual. So I do believe on a personal note, there's tremendous value. I do think there's also a need for the caregivers to know that there's value in there.
Right.
And now that's more available and on multiple platforms, any phone or device with internet, really, that the access has even reduced that need, you know, that need for change even more so. So I really want to thank you for this, Tracy. This is a tremendous thing for our community. I also believe that community care is direct patient care in a way. We always think of the needs of the patient come first, but the pivot to the needs of the community, which leads to the needs of the patient,
Right.
is also related.
Right.
And with that, any parting words for our listeners out there?
No, I'm curious about the pet boarding that you found. So
Yeah.
I want to make sure that that's listed
Yeah.
on our site. I just think it's, you know, speaking from as a social worker, it's just would be an invaluable resource because it feels like you're going like this. So you're trying to figure out where those resources are. And this is so simple. You put the zip code in, you look at the resources, and you connect. So it takes all that legwork and time out of it. So I just hope that people see some results with it and utilize it to its fullest extent.
Yeah, and that's the beginning. Real change comes with a small, and very focused group of individuals.
Right.
Anything else we need to know about the AIM network?
We just have a wide range of members of our network. We have the Social Welfare Board. We have Pivotal Point.
Oh.
We have Youth Alliance, but we have the Samaritan Center as well. So we have the ability to make referrals directly to the Samaritan Center through the Find Help platform.
Excellent. And what type of services do they provide?
They provide mental health services.
Huge. That's much needed in our communities, nationwide, to be honest. So
Sure.
these are all excellent alliances that you have, and I'm really, really glad that you mentioned them, because for a lot of our caregivers, they may not know what exactly
Right.
collaborations, alliances they might have, but this is an excellent way of showcasing them. So
Right.
thank you for that, Tracy.
Yes, thank you.
And for our listeners out there, if you have any questions or want to know the website that Tracy has mentioned, it will be listed with the podcast's publication itself. And as always, if you have any questions, they can reach directly to you. Is that right,
Yes.
Tracy? We'll give you all the information about the AIM network, the communities it supports, and the patients it supports. And with that, I would like to bid you all adieu and take care. Brush your hair.